Welcome everyone to my show. Autumn is here. I am your host, Francine Crawford. We are speaking to Nayo Akowe, who is the Clinical Director of MJHS Hospice. Welcome to the show.
Thank you, Francine. It's a pleasure to be here.
We know that MJHS Systems is one of the premier nonprofit providers for the quality care across the greater New York area. And they've done many programs with us. So my audience is familiar with the fact that they have hospice care, and they support and they guide children, adult parents, and caregivers throughout the New York City area and also for Nassau County. So we're glad to have you here. So please tell us a little bit about yourself and tell us about your journey to being a hospice clinical director.
Yes, I'm a native New Yorker. I started my nursing career working in the ICU. While working in the ICU, one of my coworkers was actually a death doula. I didn't know what that was at the time, but spending many nights working with her, I asked a lot of questions and was greatly intrigued by what I learned around this type of healthcare. It wasn't something that I was taught in school. Ironically, my family wanted me to make a change out of coming off of the night shift. And I explored hospice and have been doing it ever since.
Okay. What is it that drew you to hospice? Tell me, what did you see in that you were learning that made you be compassionate about hospice care?
The major difference that I saw was, for the first time, patients were asked, what do you want? Right? We have a concept called goals of care meetings, where we actually take time to investigate, what does the patient want? Here in hospice care, we're able to figure out the medications that are being prescribed, are they working? In community health, going into and supporting people where they live, you're able to see what works and what really doesn't work. Mm-hmm. So having that interactive conversation, respecting the clients that we serve, their autonomy, bringing culture into it, allowing the community to come support patients where they live, really provides a value add to the care that is being provided. And when people have autonomy and they're home and they're able to eat their own food and lay in their own bed, it really does make a difference in how they feel. So I loved being part of that team, an extension of the family, an extension of the medical system, being able to deliver care the way that patients really want to have the care provided.
Okay. So for listeners that may not know exactly what hospice care is, can you explain exactly what hospice care is, and including who it's for, who can use it?
Yes. Hospice care is an insurance benefit as well as a model of care that is available for people of all ages if you have a life-limiting prognosis. For adults, for instance, you have to have a life prognosis of 6 months or less, and that's if the disease continues its normal course. Most of the patients we serve are adults. We do also at MJHS Hospice care for pediatric hospice patients. Okay. There are marked differences in the eligibility criteria due to the delicate needs of the pediatric patients, and I would love to come back to talk about that in particular. But when it comes to adults, some of the things that we provide in terms of hospice as a model of care is really being able to provide professional medical treatments, professional services by having nurses, doctors, social workers, pastoral care counselors, bereavement support, pre-bereavement and post-death bereavement for family members and friends and even caregivers, creative arts therapy, which includes music therapists and art therapists, as well as home health aid services to be able to support the needs of the patients. We are able to set up what I like to call a medical home model, where when people come onto our program, they get the equipment that they need. Having a hospital bed that is able to go up and down really does help the family be able to provide the kind of care that's needed without overextending themselves and having possible injury. We provide other DME, like over-the-bed hospital table, wheelchairs, bedside commodes, shower chairs that can be quite costly when families try to obtain these items on their own, as well as medical supplies that are needed in the care of the patient.
Okay. Wow, that's a lot. I was a beneficiary of the post bereavement care, and I thank y'all so much because I never even thought about that, and it was very helpful to me. It really was very helpful to me. So how it seems like it's a lot of different wheels turning, a lot of different services that you give just in being under hospice care. Is there a team of people that do this?
Yes, you can't do it one person alone. And so when the model came to America, because hospice has been in existence across the country, across the world, culturally, people took care of their loved ones at end of life. As a part of the hospice model that is adapted through the Medicare hospice benefit, you have the ability to have an attending physician that the patient gets to select. So it could be the doctor that you've already had a relationship with that can be
Mhm.
your attending physician and continue to lead the care while you're on hospice services. In addition to that, we do have a hospice doctor that makes home visits and is available for telehealth visits. We have a nurse case manager who is the primary care person who will be implementing all of the doctor's orders. We have a social worker that is really helpful in not only providing therapeutic counseling in the home, but also to try to help families navigate the entitlements and business portions of making sure that the resources are available for care and answering any questions that you may have around funeral arrangements and any concerns that may happen in a family unit, depending on what's going on. We also have, in addition to that, pastoral care counselors, as well as creative arts therapists, bereavement counselors. And it makes a huge difference to have that level of professional support at home. I would say that for most of our families, the thing that comforts them the most is knowing that they have access to us 24/7. We have a 24-hour on-call number that is available where when people are enrolled in our program, they will have access to that interdisciplinary team 24 hours, 7 days a week. So if there's a change that happens in the middle of the night and you need someone, you're able to speak to a nurse on the phone immediately. And if we need a doctor, we have a doctor available. So you're no longer going to answering after hours, answering services, or having to go back and forth to the ER for simple things that could be managed in your home.
Okay. So that's a lot of help. Well, in New York State, we rank close to the bottom of people using hospice care. Can you tell me what reasons, because of your experience that you have, what reasons would that be, and how do we get that to, them to acknowledge and get more people involved and knowing that there's a service of hospice care?
Yes. So that is a challenge. When it comes to education, MJHS is one of the pioneers. At MJHS Hospice, we have an institute where we provide education to licensed practitioners so they can learn more about hospice, how to have those conversations. And it's now part of the curriculums, whether you're becoming a doctor, a nurse, or a social worker. So education really does make a difference. The other thing that I think is a major impact to people having access to hospice is this concept of natural death. When we look on the television, that's not what we see, right? People see people going into the ER and doctors being able to work miracles and changing what we know in the healthcare industry to be things that are not necessarily curable. And so this concept of natural death is not something that's talked about enough. When you come to a person and you actually have a conversation about what they would like, how do they see themselves? What do they want for their own quality of life? Most times people are not choosing to engage in many of the interventions and when they have choice. But when you don't have choice and we're not having these conversations in our homes with our family members, when an emergency happens, people just want to have everything done. And when that happens, many times there are people who would benefit from hospice through early intervention or even at all that are not even aware that they would be able to receive these services in their homes. So as people are going in the hospital and back home, they are at home trying to figure things out on their own. By being educated about what hospice offers and understanding that truly and what actually natural death looks like, we eliminate those fears that families may have. We allow those conversations to happen. And at MJHS, we respect the wishes of our families. So there is a lot of misnomers and myths. Like for our program, you do not have to have make a choice not to have CPR or some advanced interventions just because you're choosing to have hospice. Most of our families, once they receive our services, often tell us that they wish that they had known about us sooner. How come no one told me about this? I didn't know that this was available. Oh my God, what would I do without you?
That's exactly I've experienced that. So I definitely know that, and MJHS is one of the first programs in New York State since back in the 1980s, and you've been doing this for a long time. So I'm glad that I was able to use your services, and it was one of those things that just kind of stumbled upon. A doctor finally told me about it. So, I'm glad that you're still here, you're still doing it. And I wish that, more people knew about it and knew that it was a choice that I think people don't want to think about death.
Right.
And they don't want to think about it's the end, but it's how you go to that point. How are you going to live the quality of life until that point? There's some diseases, like you said, there's nothing we can do about it.
Mm-hmm.
But in that time before you pass, the quality of life you should have and the care that you should have, you still should have care. So thank you for providing that. Do people always? So you said that people always wish that they started sooner.
Mm-hmm.
So part of this is education, getting it out into the communities and things like that. How do you do that? Is there a way that you have in your department that you do that? Let people know about it, that you're there, and the services.
So what we have found is that most referrals to our hospice program come during a moment of crisis. Someone goes to the hospital and it is there that a new stranger in that healthcare environment is having this conversation to say, hey, we've identified you during a point of crisis to be eligible for this service. Ideally, we would like those conversations to happen a lot sooner. You wouldn't believe it that although the hospice care benefit is for a prognosis of 6 months or less, in New York City, most people are on our program anywhere from 7 days to around 2.5 months. Imagine what early access can do in terms of getting ahead of an ER visit, a fall, pain, discomfort, whatever the symptoms are that are presenting, stress on a family trying to figure this out. Hospice is the greatest gift that a loved one can give to someone who is already taking care of them. Being there and being in support of the people that you love is all about what we want to do here at MJHS. We empower the family to be able to know what resources are available. We provide education about the disease. We provide education around how do we anticipate what the symptoms are and provide the tools, medications, DME, supplies, so family members can feel empowered to be able to have the tools on hand to care for their loved ones. We also try to support and help you to know what to expect next so that this way you're not afraid going through this by yourself and dispel fears. It is so important that we begin having these conversations. You asked a wonderful question, Francine. How do we make changes so that an ER visit doesn't end up being a referral to hospice care? We do that by having the conversations in our local community, at the churches, at our local physicians' appointments, and having those conversations of identifying when a family could benefit from this, not thinking about hospice as being the last moments or last days of life, but really thinking about it as the next phase in life and understanding that in that time, so much can be done.
Mhm.
My belief is that one day that a person is uncomfortable when you only have a few days left is too much.
Mhm.
Early referrals to our hospice program, being willing to have the conversations once it's clear that you're no longer pursuing any sort of treatment in a
Mhm.
curable nature for whatever the chronic condition is is the opportunity to find out whether or not you could benefit from these services in your home covered by your insurance. And most times, whether you have Medicare, Medicaid, or private insurance, there is no additional cost in terms of copays to the family. We do a complete insurance review, and this is an entitlement that you're entitled to due to what's going on and the insurance plan that you have. Why not take advantage of it and get the support that you need? Allow your family to get the support that you need.
Yes, absolutely, absolutely. Um, so I noticed that you're reaching out in another way in social media a little bit more. I noticed that I've seen that. Tell us about that, the new videos that are aimed toward caregivers, because they're the people that are needing the help and needing the help to assist their parent, their grandparent, or their child, or something like that. So I know it's at MJHS01 that you have that out there. But tell us about some of the things that's one of the things that you're doing. So tell us about that.
Yes. There are a lot of questions around what hospice is and isn't. There's a lot of myths that are out there. So we're trying to get the word out. We've been doing hospice care, like you said, for many, many years. We're not new to this. We've been doing this since 1980s. MJHS has been in existence since 1907, the healthcare system.
Mhm.
And what we're trying to do is get the information out there. Information is key. We don't want people to fear the word hospice anymore or hospice care. We want to be able to help people to understand how we can be a benefit or a value add in your care structure in your home. It is an honor for us to be able to support you and for families to trust us with their loved ones and for patients in particular to trust us with their care. And many times you have questions around how do I do simple things? Primary caregivers, loved ones, families, husbands, wives, parents, children's friends did not go to school to become doctors or nurses. So when you find yourself in a situation providing advanced care to someone you love, you want the expertise from the people who do it every day. So we put ourselves out there in all social media platforms, and we're giving people what they need. We also take the feedback from the patients and families that we serve very seriously. And sometimes telling someone about it can be very reactionary. So we're being proactive and giving the information in advance, teaching you how to safely care for your loved one, answering those questions so that you can be an expert and feel more confident in the care that you're providing, and also trying to provide the education through different platforms because people learn differently. At MJHS Hospice, we provide written materials. We now are providing short video clips that are like a minute, minute and a half. And then we also do return demonstration when we're there in the home.
Mhm. Okay, okay. I'm glad that y'all are branching out. Y'all are branching out. It is so amazing. Is there anything else that you would like to say to the audience that maybe that can help them feel more comfortable in reaching out to hospice or reaching out to MJHS?
We are available to support you. In New York City, we cover the 4 of the 5 boroughs: Bronx, Manhattan, Brooklyn, Queens, as well as Nassau County. At MJHS Hospice Care, we are here supporting both adults and pediatric patients, and we provide an individualized plan of care. We take in consideration culture, take in consideration what the goals are, and we treat and respect the family unit. We have a We Honor Veterans program. We are SAGE certified, and are respectful of all communities, of all family units, no matter what you look like. At MJHS Hospice and Palliative Care, we are determined to do what it takes to be able to meet your needs. Comfort, quality of life, respect, and dignity are the pillars in which we stand on. And it is an honor for us to be able to support you and your family. If you have any question, no question is too big or too small. We're happy to help you. And they can feel free and reach out to us on any of the platforms, and we will respond as soon as possible.
Awesome, awesome. Well, thank you so much. Like I said, when you're talking about this, it just reminds me of the things that I went through, and reality was that I didn't know, and I didn't have that experience, and I wish I had places and somewhere to go to answer questions, because you're making decisions on your parents' life. And like you said, I didn't have a doctor or nurse in my family to explain exactly what was going on. So I got into my mom into hospice very, very late. So she wasn't there for a long time. But, when you're talking about it, yes, I wish I would have been able to provide that for her if only I knew and understood what that meant. So thank you for sharing your information. Thank you for letting us know that hospice is out there and MJHS is out there serving the community in this way. And I just appreciate your time and being able to explain it so people will be more comfortable with reaching out and knowing that the service is there. So thank you, Nayo, for all the information that you gave us.
Thank you so much for having us, and thank you for trusting us with the care of your mom.
Oh, I really appreciate it. And it made a difference in the way I looked at people dying, and that I knew that there was a need for people to understand this, because there are people who are overwrought with emotion at that time, and they can't make clear decisions. And it would be nice to have somebody professional to hold their hand through it, kind of, and just to explain what's going to happen also, because the unknown is scary.
Absolutely.
So I really appreciated your help. And I know this is going to benefit other people, and we just really need to keep pushing to get people, involved in this and know that this is here for them. It's for you. So thank you again.
You're welcome. Thank you.